Hello everyone. So today let's discuss about cerebral cortex. So again, question we'll take from the ministry book. Question number 106. A patient after brain blood supply disturbance lost the ability to write letters and figures. In what lobe of the brain was the pathology? So first of all, there are 5 lobes and all these names are already written in this question in the frontal, parietal, temporal, occipital, and insula. And in this picture, you right now can't see insula because it is covered by the temporal lobe. So there are many sulci and the gyri, as you can see in this picture. The sulci are the grooves and the gyri are the bulges. Let's talk about the main sulcus first. So first of all, there is a central sulcus. This is a central sulcus. That divides the frontal lobe from the parietal lobe. And then there is a lateral. It is the lateral or the Sylvian sulcus. It divides the upper frontal and parietal lobe from the temporal lobe. And there's another sulcus that you need to remember is the calcarine sulcus, but it is visible only on the medial surface of the cortex. So again, it is important, but it is seen on the medial side. Okay, so let's start with the very basic concept, that is the primary motor cortex, primary sensory cortex, primary auditory cortex, and primary visual cortex. So the gyri, this which is present in front of the central sulcus, this is the precentral gyrus. What is it called? The precentral gyrus. And the gyri after the central sulcus is called the postcentral gyrus. The postcentral gyrus. So this is the, from here, this is the postcentral gyrus. So the precentral gyrus is the primary motor cortex. That is, it controls the contralateral side, and the postcentral gyrus is the primary somatosensory cortex. That is, it receives the information of all the general sensation from the contralateral side of the body. The temporal lobe again has 3 gyri, the superior, middle, and the inferior gyri. And the superior gyrus, it is the primary auditory cortex. And the occipital lobe, this is a visual cortex. So again, the frontal lobe is responsible for all the motor movements of the body, and the parietal lobe is mainly, or basically the postcentral gyrus which is present in the parietal lobe, it is mainly the primary somatosensory cortex that receives all the general sensation from the contralateral side of the body. Temporal lobe is for the auditory, the hearing, and the occipital is for the visual or the seeing. So again, there's also frontal lobe is again divided into the superior gyrus, middle gyrus, and the inferior gyrus. It is not visible clearly, but in the inferior gyrus, there is a Broca's area, which is responsible for the motor speech. I'll make a separate video for all the speech related areas and the problems. And along, like, so the primary auditory cortex is here, but the vernix area It is also present in the superior temporal gyrus, and it is for the sensory speech. Just take the notes. If you want to know more, then just wait for my next video. So that was the main, and let's write it here separately as well. That is the frontal. The frontal cortex, first of all, it has a primary motor cortex that is responsible for controlling all the movements of the contralateral body. It controls the contralateral part of the body. Then again, it has a frontal eye field. So the frontal eye field is responsible for the horizontal eye movements. So again, the important one, that is the Broca's area. It is in the inferior frontal gyrus. And it is again responsible for the motor speech. Next, the parietal lobe. So the parietal lobe, it has the primary somatosensory cortex, which is present where? In the postcentral gyrus. And again, another question that was asked in Krok, that was about the superior parietal lobule. So superior parietal lobule is right here, and it is responsible for stereognosis. That is a spatial recognition of objects. So what does it mean is that, so when you touch an object, all the sensations are received in the primary somatosensory cortex, but recognizing an object by touching it and without seeing it, that is called stereognosis, and that is for the superior parietal lobule. That is by the superior parietal lobule. There's also a supramarginal gyrus. Okay, so it's not quite visible here, but it is present here like supramarginal gyrus, and it is mainly for the learned purposeful movements. So what does it mean? That the everyday work, for example, I'm writing, or I know how to comb my hair. So these are all the learned purposeful movements. And if a person suddenly can't write or can't comb his hair or just forgets how to drive a car, so that where will be the problem? The problem will be in the supramarginal gyrus, because it is responsible for the learned purposeful everyday movements. So next, let's talk about the temporal lobe. So temporal lobe, the superior gyrus is the main gyrus. So what is present in the superior gyrus? It is the primary auditory cortex. So a special thing about this is that, for example, the frontal cortex or the parietal cortex, they were receiving or they were controlling the information on the contralateral side of the body, but this cortex receives information from both sides of the body. Basically, it receives information from both the ears. And why is it important to know? I'll show you in a question. So what was here? The Wernicke's area. So Wernicke's area was for the sensory speech. Again, this was the occipital lobe. Occipital lobe, basically it has a primary visual cortex. So that was about this. So now let's look at this question. They're saying he can't write. He can't write. All the motor movement is affected. So the answer is frontal. They are not talking. They are not talking about the hearing. They are not talking about the sensation. They are not talking about the visual problems. So the answer will be the frontal cortex. So let's move on to the next question. For example, this one. So what is it saying? That there's a trauma that has caused dysfunction of the motor centers regulating activity of head muscles, and in what part of cerebral cortex these centers are located. So you know that all the motor centers are basically where in the precentral gyrus, but what part, the inferior part or the superior part? So let's see. So there is something called homunculus. What? Homunculus. So homunculus is a diagrammatic or schematic representation of the different parts that have different parts of the body on the cerebral cortex. So let's look at this picture. This is a motor homunculus that is present where in the precentral gyrus. So you can see the inferior part is controlling all the muscles of head and neck. The upper part is controlling the upper limb, and the most highest part is basically controlling your pelvis and perineum. And on the medial side, there is present what? The lower limb. So let's write it down, because so on the lateral side, the inferior part is controlling the muscles of head and neck. The upper part is controlling the upper limb. And the most upper part is controlling the pelvis and the perineum. Now, on the medial surface, the medial surface is what is present on the medial surface? The lower limb. So, this is the diagrammatic representation of various parts of the body on the motor cortex or the sensory cortex. So, in this, you can see that the hands have more area on. Same in this picture, the hands have more area distributed on the cerebral cortex because all for the fine movements of the hand. So, and this is a sensory homunculus. It is not as important as a motor homunculus, but still if you want to refer to it, you can see. So again, this question, they were asking about the muscles of head. So inferior part of precentral gyrus. So another important point I want to tell you, it's not only important for answering the Krok questions, but also because different areas of cerebrum are supplied by different arteries. So for example, all this lateral area, they are supplied by the medial cerebral artery, while the inner portion of the cerebral cortex, it is supplied by the anterior cerebral artery. So if there's a lesion in the, or if there's a problem or ischemia in the region supplied by the middle cerebral artery, the lower limb will be spared because it is supplied by the anterior cerebral artery. So anterior cerebral artery was supplying the medial regions, and what is present, what area of the body is present on the medial side, that is the lower limb. So that is why in the anterior cerebral artery problem, there will be problems in the motor function of the lower limb. So Now let's discuss some questions regarding to this topic that are asked in the Krok. So they are saying, in response to sound stimulus, and this condition reflex will not be exhibited after extubation or the removal of the following areas of cerebral hemispheres. So sound is the primary auditory cortex is located where in the superior gyrus, superior temporal gyrus. And superior temporal gyrus is present where in the temporal lobe. So why on the both sides and not one side? I told you that all the information that is from the left, so normally the left part of your body controls the right part, or it is receiving information from the right part of your body, but the temporal lobe, it receives information from both parts of the body, from both parts of basically ear. So the left temporal lobe receives information from both left and right ear. Okay, so next question. After craniocerebral trauma, a patient has lost the ability to execute the learned purposeful movements. I told you in the previous I told you previously again, this will be what Gyrus Supra marginalis, and it is present where in the parietal lobe. Another question similar, that is the question number 109. And the patient has inability to perform woodwork, which demands accuracy, and as his right hand had been doing a lot of errant movements for 3 months. So basically, he was doing woodwork for so many years now, and now he can't do it. It's not like it's not like he can't do it, that his hand is not moving. If it was given that his hand is not moving at all, so that will be the precentral gyrus, because the precentral gyrus was controlling, precentral gyrus was for all the motor movements. But they're saying he can't do it as accurately as he could do it before. So again, that was a learned purposeful movement that now he can't perform. So the answer is supramarginal gyrus. So next question, question 134. After craniocerebral trauma, complaints of impossibility of exact movements of upper limb. He cannot button, it is an everyday work. He cannot light a match, cannot pour water. So they are saying that he cannot do these easy tasks with that much accuracy. So muscle strength, deep muscular sense, and mechanisms of coordination are preserved. So mechanisms of coordination, that is that there's no problem with cerebellum, or muscle strength, that is his muscles are still working, but he cannot perform the tasks with that much accuracy as he could do before. So the answer is again the supramarginal gyrus. So next question. Patient has sharp hearing injury. Examination excludes sound conducting and sound perceiving apparatus pathology. So they are saying that sound conducting, that all the nerves, and sound perceiving, that is all the parts of the ear, they don't have any pathology, but the person still can't hear. So why? Because maybe there's a damage in the gyrus and not in the ear or in the nerves. So the answer is what? Superior temporal gyrus, because it is here where the primary auditory cortex is located. So next questions. Again, question number 146 of the ministry book. That the occipital lobe or the calcarine sulcus. I told you that the calcarine sulcus is present on the medial side of cerebral cortex, so it is not visible if you look at on the lateral view of cortex. So here is the primary visual cortex located. So the vision is absent. So can you tell me about the other options? If the movements are absent, in which lobe there will be a problem? In the frontal lobe. Hearing, in the temporal lobe. Olfaction. So olfaction and the sensitivity, it is mainly for the general sensations. So again, this will be what? Post central gyrus or in the parietal lobule. So next question. This question again, he has lost the ability to recognize the shapes of objects by touch. So he can touch it. He knows he's touching something. So the touch is preserved. That is the post central gyrus. It is working fine, but he cannot recognize by just touching the object. That is stereognosis. That is of the superior parietal lobule. So if the patient basically now has a stereognosis. Okay, these are all Krok questions. So next, again, very easy. The patient had stopped to distinguish the displacement of an object on the skin. A general sensation, again, posterior central gyrus, which is a primary somatosensory cortex. Here again has decreased skin sensitivity, so it is primary somatosensory cortex located in the posterior central gyrus. Now, during a brain surgery, stimulation of cerebral cortex resulted in tactile and thermal sensations in the patient. So again, the same reason, posterior central gyrus. And now, same question, cerebral hemorrhage caused serious disturbance of the taste sensibility. So out of all the main sensations, the visual is in the occipital lobe, hearing is in the temporal lobe, taste, the touch and the smell, all these are in the posterior central gyrus. So that were all the questions related to the cerebral cortex and its areas and its gyrus and lobes. So that's it for this video.